So I think we are in a new era of taking care of patients with diabetes. For a long time, the FDA has mandated that when a new drug comes out, you want to make sure that it not only improves glucose control, but that it also is not potentially harmful in terms of cardiovascular risk. For the first time in a very long time, we have new drugs that not only are they not harmful, but they're actually helpful in preventing cardiovascular events, right? So we have GLP-1 agonists or GLP-1 agonists, and they were shown to reduce the composite of cardiovascular events. And we have SGLT2 inhibitors, which too were shown to reduce cardiovascular events in addition to improving glucose control. I think when you look at the original studies and you look at the original data, I think that there are important differences in how the drugs prevent cardiovascular events that should drive when they are being used. So for example, the GLP-1 agonists, when you look at what part of the composite of cardiovascular events they reduce, it appears to be more in terms of preventing atherosclerotic cardiovascular events, like heart attacks. When you look at the SGLT2 inhibitors, their data is fantastic, very impressive, but when you look at how they reduce cardiovascular events, it's really driven by their reduction in cardiovascular death and their effect on heart failure endpoints. So to me, it appears that maybe these drugs should be targeted to individuals that are at highest risk for each of those components. So for example, somebody who is at risk for heart failure as an endpoint, or perhaps in a rhythmic type of death, perhaps an SGLT2 inhibitor would be the first approach. Somebody who may be at higher risk for an atherosclerotic endpoint, perhaps a GLP-1. But I do believe that there are patients, and there is a rationale for certain patients to be treated with both compounds. And I think that we are in a new phase, a new era, where we have this option of really targeting not just glucose control, but also cardiovascular events. So as a practitioner who takes care of patients with diabetes, I think this is a really exciting time.